Hi, this is Marvin Plackett, and today is Thursday, June 25th. Greetings to all residents, to all staff, and to all guests. We have no new confirmed COVID-19 cases. Very pleased to report that. Also, very pleased to report that yesterday, as you know, we had 5 active COVID-19 cases, 2 residents, 3 staff. 2 of those 3 staff, yes, 2 of the 3 staff have now fully recovered. They're back on duty. That means we are now down to 3 active cases at Episcopal homes. 2 are residents, 1 is a staff person. Both residents, of course, are on the 2nd floor of Episcopal Church Home. So we will celebrate every single one of our successes. Delighted to have those 2 staff back fully recovered. Testing at the gardens, as you will recall, occurred throughout the entirety of the gardens. So all 60 residents, and then I'm not sure how many staff, but probably over 80 or 90 staff. They were tested on between Tuesday and Wednesday. And so a total of 165 tests were administered. And we've received 74 results so far, and all of them are negative. Hopefully, we will be receiving the remaining results of the 165 total tests tomorrow. We will see, not sure, or maybe even later today. But we look forward to finding out where we stand, of course, at the gardens at this moment in time. And it's certainly a good sign, a good initial sign, that 74 of our 165 all came back negative to this point. We will keep you posted on that. As you know from watching the news, there are record cases in a number of states, record highs. And so in there are a number of hot spots in the country. Most are in the south and west. And for instance, in Texas, yesterday they had over 5,500 cases, their highest number ever in one day. That is their active COVID cases. They had an additional 5,500 cases. Here in Minnesota yesterday, we had an additional 304. Now, obviously Texas is larger. Their population is roughly 5 times that of Minnesota. But even if you do that math to compare apples to apples, 5 times 300 is 1,500, in contrast to 5,500 cases in Texas. So it's really careening nearly out of control in some states, and while it is under control in Minnesota. And here at Episcopal Homes, of course, our high point was a month ago, just a little less than a month ago, at 22 active cases. And we are now down to 3. Remember, that progress in the state, that progress here at Episcopal Homes, is only due to everybody's vigilance, protecting one another. And the way we do that are those tried and true techniques of social distancing, staying at least 6 feet apart, wearing a mask at all times that you're not in your own apartment or in your own room. Frequent hand washing, and if you have any symptoms, immediately self-isolate, inform us, and contact your healthcare provider so that you can get tested promptly. Those key features are so utterly vital, not just here at Episcopal Homes, but wherever we might go, whether it is to church, whether it is to a restaurant. And of course, if you go to a restaurant and if there's outdoor seating, that is much better. According to Mike Osterholm, Dr. Mike Osterholm, epidemiologist at the University of Minnesota, he said that events that we partake in outside are substantially less risky than doing things inside, because that outside air sort of filters things very rapidly. So how we live our lives, whether it's here at Episcopal Homes, whether it's the churches that we go to, or what we do in our social life, or as we visit anyone, how we conduct ourselves in terms of the social distancing, the wearing of masks, the frequent hand washing, and making sure, of course, that you stay away from anyone that might have symptoms. Those things really matter, because we sure don't want it to come roaring back at Episcopal Homes or anywhere in the state of Minnesota. And remember, that means that we have to all look out for one another. It's not just looking out for ourselves, It's looking out for one another. Because remember, most people, or many people, I'm not sure what the latest statistics are on this, but many people that have COVID-19 actually don't even know it. They don't have symptoms. And so if I have it and you don't, but if I am wearing my mask and staying 6 feet away from you, and you're doing the same thing, then I'm not going to pass it on to you. But if I'm violating those principles, and I pass it on to you, even though I might be perfectly fine, no symptoms, no harm done whatsoever, but if I pass it on to you, you might die. And that's the reality. That's not hyperbole, it's not exaggeration, right? You might die. Or let's reverse it. It might just be the opposite. You might be fine, and I might die. So the point is, it isn't just about protecting yourself, it's about protecting one another, and then in that way, we protect our whole community. So, vital that we remain vigilant at all times. And thank you so much for all that you do. I know this is not easy. It never has been, not from the beginning. And of course, there's no near, let me say it another way. According to the experts, they're saying that a cure or vaccine, that's the word I was looking for, thank you. There's no vaccine in the immediate horizon. Dr. Fauci said possibly by the end of the year or early next year. That's rather optimistic based on a lot of people's estimates. But the point is, it's a minimum several months, maybe longer, before we have a vaccine or some remedy to work our way out of this. Eventually, life's going to return to normal. We're confident of that, but we just don't know how soon. And in the meantime, keep yourself safe, keep one another safe, and let's be vigilant. Good to be with you. I look forward to seeing you tomorrow afternoon at 1:30. Bye-bye.